Good morning. Thanks for joining us. And the title of our presentation is Obesity and Metabolic Syndrome. Are they associated with prostate cancer? We are Group 3, and we're Winston, Jianxing, Bal, and Abhijit. Prostate cancer. It's the most common cancer in men. And we would like to hear from someone about that. So let's take a look.
If you're accumulating wealth,
Billionaire investor Warren Buffett says he's been diagnosed with early-stage prostate cancer. The Berkshire Hathaway CEO told his company shareholders in an open letter that his condition is, quote, not remotely life-threatening or debilitating. Buffett said he was diagnosed April 11th. He's one of the world's richest men, and alongside Bill Gates has become known as one of the most generous philanthropists. The 81-year-old says he and his doctors have decided on a 2-month treatment plan that is to begin in mid-July. So far.
So prostate cancer can affect anyone, and so we certainly see that. It's a disease that affects the prostate, reproductive system of the male. It's the most common cancer in men, so 200,000 new cases and 30,000 deaths in 2010. 1 in 6 men will be diagnosed with prostate cancer in their lifetime. The causes of prostate cancer are related to age, race, ethnicity, and family history. If you have a first-degree relative with prostate cancer, you're more likely to get it. It's important to note that these established risk factors are not modifiable. So primary prevention is not recommended currently. So there's a great interest in these other risk factors, such as diet, physical inactivity, metabolic syndrome, and obesity. So what is metabolic syndrome? And let's hear from another expert.
The medical establishment defines the metabolic syndrome based on 5 different abnormalities or 5 different individual diseases, and those include elevated blood pressure or hypertension. So if a person has elevated blood pressure, then they have one of these 5 abnormalities. There also includes the elevated triglycerides, which are a form of circulating fats in the bloodstream, the elevated blood sugar, which of course leads to diabetes, and then an abnormally low level of the good cholesterol, or what's called the HDL, or high-density lipoprotein. Those are the first 4, and the last one is simply an enlarged waistline, abnormal measurement of the waistline. So that's clearly related to weight gain. So if a person has 3 of the 5 of those abnormalities, then they qualify for and are given the diagnosis of the metabolic syndrome. In the past,
Metabolic syndrome is 3 of these 5 conditions, and so it's metabolic syndrome may be associated with prostate cancer risk. One study, it was 34 years long, longitudinal study, did find an association with prostate cancer and metabolic syndrome. N was 2,300. Another cohort study found an inverse relationship. So that was a cohort of 6,400 adults. So clearly there are some inconsistent results. And another aspect of this would be that diabetes, a closely related metabolic disease, reduces the risk of prostate cancer. So that is a subject of great interest. Obesity is associated with prostate cancer, especially aggressive forms of the disease. Most of this research has relied only on BMI, and BMI is not really a measure of centralized body fat, of abdominal fat, and we wanted to look at that in our study. So our aims here are to assess the association between abdominal obesity, metabolic syndrome, and BMI, and their association with prostate cancer risk. Our objectives here are to identify cancer patients. We will compare them with matched controls. So we will propose to measure these factors. Prostate cancer, which would be assessed in both cases and controls. We want to make sure our controls are cancer-free. Abdominal obesity, we plan to use body mass index, waist circumference, and waist to hip ratio to look at abdominal obesity. And then the presence of metabolic syndrome, which has been described. Our methods here are a case control study. We plan to look at African Americans and whites because they have a higher risk, and we would like to identify those from Houston. We'll select our controls from the same zip codes as the cases that we identify, and we will do data analysis. We'll generate 2x2 tables to calculate odds ratios adjusted by age, race, and family history. A logistic regression model will be used to control for our covariates, and in our regression model we will control for the factors described. These are some hypothetical results. A table like this would demonstrate that we were successful in selecting our controls, and you would be able to see here that they are the same cases and controls. Also, this is another hypothetical results table where we would how we would like to show the odds ratios between those with the risk factors we've described and those without. So discussion, this would actually be one of the largest case control studies on metabolic syndrome and prostate cancer. We'd like to add to the literature and help to resolve some of those conflicting results that we mentioned earlier. We do acknowledge some limitations. Our analysis plan assumes that metabolic syndrome and abdominal obesity are independent. These would be correlated, so we would need to account for that. The logistic regression model, we calculated our power from our basic 2x2s, so we would need to be cautious in interpreting regression analysis results. And finally, we would consider this study a success if we could detect an effect with an alpha level of 0.05, and certainly that would help us reach the results that we're looking for. And finally, we would like to acknowledge our references and certainly open up for any questions.